Mental health is extremely important for all of us. As an individual, at work, in our community, we don't realize, but having a healthy mental health means having a healthy life, having a healthy workplace. Taking care of our patients, not only the physical part is important, but also the mental part.
Mental health is an invisible illness, and it affects so many. We need more understanding, more education.
It is an illness that affects so many people. It does not respect anyone. And say, for instance, the attention that a heart patient gets, a mental health patient is treated otherwise.
We need to continue to push the awareness of mental health and reduce that stigma. I think what's really important is money for community resources, so some type of outreach programs that kids can go to for counseling or whatever it is their needs be. And then of course we need more mental health beds. We don't have enough and we're bursting at the seams.
For me, the issue for mental health is a priority because, one, it's my job, but second, it's my passion. I did mental health for a long time in the States and see a great disparity in the need for services and the availability of services in my small community anyway, out on the east end of the island. It takes more than 2 weeks to get someone seen in the community mental health system, but I see people through the emergency room, inpatients, staff's families, a lot of supportive family counseling kind of stuff that goes on, and the need is phenomenal.
The politicians, our premier should get involved, definitely. They need to recognize it, first of all, has almost a physical issue, a physical problem. It's the same thing because we tend to take care of the physical and not the mental. So we need it to be on an equal platform, and we need to really step up and give more care and more attention to the problem.
Mental health issues are increasing, funding is decreasing. Standards are being raised with no money coming in to meet the standards. And we need to begin in the community.
It's a year wait in the lower communities, in the smaller community, to get somebody in to see the psychiatrist. That is not acceptable care. It just isn't.
Go to Calgary, go to Toronto, go to the small towns, see what it's actually like, and then perhaps you can have a little bit more understanding that we are bursting at the seams and this is a real big issue and it's costing us a lot of money.
As a group of nurses, I think we have the power to bring about change. We need to be mobilizing our members to lobby the government.
Pharmacare, I think, should be a national program, along with what Medicare was supposed to be in the beginning. And I think our pharmacy costs in every province, certainly in Alberta, are hugely taking a good chunk of our health budget. And if we would budget and all be buying from the same place and have standardized brands and stuff we're using, I think we could save all across the board.
The patients that nurses see across the realm, with various issues, diseases, the issues that they're facing, some of those drugs are hugely expensive. And for some patients, it might not be the cost, but rather their financial status. And making that field, if you will, even for everybody, that's cost effective, so that everyone can receive proper, adequate health care that they require, not based on income, not based on what they can afford at any particular time.
I also deal with a lot of seniors. Some of them cannot afford the drugs, and some days they decide, do we eat or do we take our drugs? Do we have a roof over our head or do we take our medications? And it just shows to our government, if we don't have all of that covered, we're going to increase the cost of our health care because we have more seniors in our hospitals.
My parents are getting older. By no means are they old, but my mom is on a lot of medication. She's an asthmatic, and I know she pays a lot for her prescription, and I know what she gets a year.
I believe that there should be no restrictions for anybody in Canada. Everyone should be equal. I think it's important that we give equality to every patient and that everyone can have equal pharmacare. There's a lot of socioeconomic statuses that may not be able to afford.
I think it's important to start now because any day that someone does not take a particular medication decreases their level of health. And one person can make all the difference. And if they are healthier, they are more productive. If they work longer, they work better. If they're with their family, they participate more with their family if they're healthier. So it makes everything better in all aspects of society.
I think in the long run, the governments will be able to save money by allowing anybody to have this pharmacare.
The time has passed. Let's not miss it any longer. Let's get on board. It's affordable. It can save billions of dollars to the Canadians and Canadian government. Let's do it. It's not too late. Let's get on it.
It's time. We need to stop the talk. We need to enact. We have to bring it about so that the citizens of this country can feel safe and know that when they need the drugs are there, that they're not going to have to decide whether it's their everyday living expenses, such as eating and paying their rent, that they can take their medication and they can be healthy and know that they're going to stay out of hospitals.